drama.
You know what we mean by that. Stay away. But we're happy to have you with us, Doc. It's an exciting Saturday. There's always so many wonderful things to share about the feet. And we're excited that you bring to the airwaves here on WDAO Footsteps for Life each fourth Saturday of the month. So we're excited to have you back once again. I know we just were here a couple of weeks ago, actually doing the April show a few weeks ago. But today it's your scheduled May show. So we're stepping in the name of love again with Dr. Tanisha Richmond. She is our local podiatrist and foot specialist. So if you have any questions or comments, you can give us a call at 937-457-1210. And Dr. Richmond's office is located at 1323 West Dr. Martin Luther King Jr. Way. And of course, that's West 3rd Street, inside of the Dr. Charles R. Drew Health Center. So, Doc, you good?
I'm good. And I'm also streaming live on my Facebook page. I think it's Tanisha Richmond or Richmond Foot and Ankle on Facebook.
Check both of them.
Check both of them. I'm still learning.
It's all right. Just check them both.
Yeah, I'm still learning.
You'll find her there. So, Doc, it's a beautiful Saturday.
Yes.
Lots of people are out today, I'm sure. And I'm sure they've got open-toe shoes on. So,
yes.
What can you tell us about that? Let's start right there, and then you can go into your show for the rest of the day. They've got those flip-flops on, I'm sure. Those sandals.
Flip-flops.
They're at the beach. They're at the pool.
Yeah.
So what's going on with our feet today? What should we be doing?
Well, main thing is wearing shoes. Do not walk around barefoot. Then you'll have to come see me or go to the ER or urgent care when you step on something and you don't know what's in your foot. So that's the first thing. Flip-flops. Just be careful. Flip-flops give you no stability when you're walking. You can step on a curb or something, uneven and twist your ankle or fall. Open-toe shoes. Just make sure, especially if you're diabetic, if you have to wear your shoes, make sure when you get home to check your feet. Make sure you didn't cut yourself, any sores or any problems. Mm-hmm. And especially diabetics who don't have a lot of feeling, especially if you're out and you're walking a lot more than normal, really check your feet when you get home for blisters. Because if you're not used to walking, you may get some blisters or other things happen to your feet.
Gotcha. Now, Doc, I can't help but notice your shirt. Your shirt is reading, "When a Band-Aid just isn't enough."
Yes, this is also.
Tell us about that.
Yes,
y'all can't see this, but I see it, and I'm
I can show it to people on Facebook.
Yes, her shirt says, "When a Band-Aid just isn't enough." What is that about?
This is actually my colleague's urgent care in Trotwood. I actually wore her shirt today. She owns the urgent care right in front of Burlington Coat Factory.
Awesome.
So this is her logo. This is also another African American owned business. It's female owned business.
So when a Band-Aid just isn't enough, you go to first priority urgent care. That's
what
you do.
Yes. Hopefully she'll call in today, but she just had a baby, so she gets a break.
All right. So you were saying people are out. Well, first of all, you usually give us an update on any trips that you've made, visits, any particular conferences that you can share with the listening audience. Tell us about what you've been doing in the last couple of weeks, besides the practice, of course. We know that you're busy.
Last week, actually I was in Columbus for our national convention, and next weekend I'll be in Gatlinburg, actually, for a pediatric conference. And then in June I'll be in Seattle for some other kind of conference. So I'll be surgical. But, last time we talked about the opioid addiction and the gabapentin abuse, things of that nature. That's pretty much what is on our radar right now. And then also as for physicians, someone was making a joke, actually, saying he had glaucoma and he needed marijuana. And if you do have glaucoma and you need marijuana or want marijuana, you have to see a eye doctor, not a foot doctor. And only people in the state of Ohio who currently can prescribe marijuana are either MDs or DOs. So nurse practitioners, podiatrists, we cannot prescribe marijuana yet. But if that is something people are interested in getting certified, they can go on to the state medical board, I think, or probably the DEA, and get a list of doctors that are certified to prescribe. Not every physician is certified to prescribe marijuana. And I know there is one place, I think, close to Columbus, and then I think we just got approval for somewhere here in Dayton, but it's not open yet. So if people really are interested in that, they should go online to the state medical board and find out which physicians are prescribing, and then find out locations. Because you can get medical marijuana, but you do have to have, there's like 20 to 30 different diagnoses. And if you have this and you see a doctor and you're certified, you can get your medical marijuana.
Now, we obviously see people tweeting and sending us Facebook messages of trying to get an understanding. So tell us, what would be some of the reasons, Dr. Richmond, why one would need medical marijuana?
Well, one is glaucoma, actually, neuropathy, chronic pain. Probably the biggest one is pain, different types of pain. For medical marijuana, neurological diseases, seizures. I think it treats autism, treats a lot of different things. You would have to go to the site to see every single reason. But I mean, the biggest one is just pain in general. It treats pain. But then if you talk, people are also talking about this CBD oil, which is now, it is illegal in the state of Ohio.
Did you say it's legal?
Illegal.
It is illegal.
Now, you see it in the gas stations, you see it all these different places, but technically it is illegal unless the only people that can legally possess CBD oil has to have a marijuana card, or physicians can only dispense CBD oil if they are marijuana certified.
So what would this oil do for someone?
They're pushing it as a topical pain reliever, so they'll mix it like with creams, and you can rub it on your arthritic joints and stuff like that. I mean, recently a lady was arrested at Disney World because she had some CBD oil in her purse. And she went through security. She
forgot to take it out.
Well, she's from another state. I think she's from South Carolina. Florida's CBD oil is illegal. So she was arrested at Disney World for about 24 hours. She was in jail. They did drop the charges when it hit the media, but it's just a lot of confusion.
And inconvenience. For
her. But they
mm-hmm.
said if you're traveling, like if you're driving state to state, you need to know which states is legal, which states is illegal, because if you're stopped, then it's a problem. You know, especially if you went to Denver and you got all this weed, which is legal, but then you decide you want to fly into Ohio, remember, you got to go through TSA.
Even bringing the gummy bears and suckers that
yes,
come from
because
Denver.
I've flown to Denver. They have drug dogs. They're searching everything because people are flying all over the world where marijuana is not legal. Mm-hmm. So it takes about, that TSA, I think it took almost 2 hours to go through. Because of all the drug checking when you're flying. So that's another thing when people are flying this year during the summer months, realize it may be legal in this state, but it may not be legal in this next state, or or where you're flying to. Mm-hmm. I wouldn't put it into your carry-on luggage.
Gotcha. So, Dr. Richmond, how often are you asked about whether or not you prescribe medical marijuana, and does it come up in your office about selling the CBD oil?
Oh yes, it's everywhere. It's a big talk. Actually, the conference I went to in Ohio, there were people trying to get us to sell CBD oil, and I was telling them it's illegal in Ohio and then the state medical board was at that conference, and I asked them the question. They said the only way we could have it in our possession, we have to be certified to dispense it. And then the only way a person, if they were ever caught with CBD oil, say like a pullover traffic stop, as long as they have that marijuana card, they're safe.
Okay.
But if you're just buying it at the gas station, you get pulled over, depending on what that cop or whoever feels like that day, mm-hmm. you could be arrested.
Exactly. So know the laws.
Yes, know the laws. Mm-hmm. Do not follow what Baby and Boo Boo tell you. Google it. Go to the medical board. Read the law, because the law is what will either put you in jail or keep you out.
All right. So what's new with the feet?
Well, we are actually, I'm working with Dr. Marar we're working towards a nonprofit and educational outreach program to educate the community about preventing amputations. It's called AmpuStop. It's just a organization that we're going to utilize to give information to the community, online and everywhere, just to get people to understand that amputations are preventable. I actually talked to one of my patients. It was a Caucasian lady who had been a smoker probably 30, 40 years. And she told me her mother lost both of her legs. And they were both diabetics. And she was concerned that she would lose her legs. I said, no, we're in a different time, a different age. Back then, they didn't have the technology that we have. They didn't have the screening tools that we have today. So if your aunt or uncle or mother or father lost their limbs and they were diabetic and you are now diabetic, that is not a guarantee anymore. But it is something that has to be screened. We do the screenings in our office. Just a blood pressure cuff on your arms and legs. Then that screening is sent to a vascular specialist who looks at it, then determines if there's further testing that may be needed to be done or procedures. But this is all preventative. This is all to prevent an amputation. And when you talk to people, they don't understand all of that now is preventable. It doesn't have to happen. It still happens, and it happens the most in African Americans. Mm-hmm. But mostly I think that's due to lack of exposure or living in somewhere where there's not a good vascular group or even not even seeing a podiatrist. Because that also is a major component. Seeing a podiatrist regularly, we see the feet. We're the only people really look at your feet. Your primary care, if you're lucky, you may look at them. But every single time, we're going to look at both feet. Like I tell my staff, if they have 2 feet, I need to see both, unless they don't
Not just one shoe off and one shoe on. Right?
Yes, unless they only have 1 foot. But we are the people, we are the gatekeepers to the lower extremity. This is what we do. We want to see your feet. We want to get up and close and look at them, smell them, everything, and look between your toes and all those different things, because we know just a little problem, a little spot can be turned into something major.
Yes. So, and that's key. And Doc, you mentioned before the feet, when you examine them by someone that's professional as yourself, that knows what feet should look like, should smell like, should feel like, how is it? It's just really amazing that your feet can tell you so much about a person's health and their diet. Talk a little bit about that.
I always tell when I speak to other physicians or anyone in the medical field or just people in general, pretty feet are healthy feet. It's just that simple. If someone takes their shoes and socks off, and their feet are pretty, their skin is supple, it's not ashy, it's not dry, it's not flaky, their nails are clear, they're not fungal and thick and crumbly. Mm-hmm. Their skin is the same, the color of their skin on their feet is the same color as their arms and their face. Mm-hmm. Like I saw a lady the other day, she was chocolate with caramel on top and jet black on the bottom.
So what does that tell you?
She has vascular disease. Because her skin color is changing because of lack of blood flow. So, or if I look at a person's feet and legs and I see no hair, that's a problem. And lots of times they'll say, well, I've never had hair. No. And I'm like,
and when you say have hair, where should that hair be?
It should be on their toes. It should be on their feet, their legs. I mean, maybe not on the top of their feet, but at least on their calves. Mm-hmm. When I look at their calves, I should see hair. If I start seeing missing patches of hair, or the hair stops and doesn't start to midway up the calf, that's a vascular problem, because that tells me the blood flow stops at that level.
I see.
It's just like a plant. Nothing's flowing, nothing's growing. So if there's no blood coming down, it can't feed the hair follicles. Okay.
So what about blotches? You see some people, well, not African American, I guess their blotches would be red, but usually African Americans, they're darker blotches, spots in different places.
Now, those could be different things. They could be like melanomas, this form of skin cancer. Blacks, we are more likely to get a melanoma, which is a form of skin cancer. It can look just like a mole or a spot. Whenever I talk to patients about melanomas, I talk about A, B, C, D, E. So we talk about asymmetry. Is it just a uniform circle or is it irregular? Mm-hmm. B is borders. Is the borders even? And then color. Is it a uniform color or is it like blue, purple, different shades? The D is diameter. Is it bigger than the tip of a pencil?
Mm-hmm.
And then E is elevation. So if you rub across it, is it like irregular or is it smooth?
Mm-hmm.
And then also, is it something that just started? He wasn't there last week. Now it's there and it's growing,
mm-hmm.
or it's bleeding.
Mm-hmm.
Could be a medical emergency. Melanoma can kill you quickly because it's in your skin. Your skin covers your entire body.
Sure.
So you'll hear people, basal cell carcinomas, which is usually in the face. You'll see you don't really see it a lot in African Americans, but sometimes you may see older white people with a Band-Aid on their face in different places. Most likely they've had a skin biopsy.
Oh.
And on their nose or something. And then I went to dermatologist and they did a biopsy or they took it out, the skin cancer. But in the feet, most of the time that's more of a melanoma, which is more deadlier. So, but I mean, when I tell patients, if it's a spot you're concerned about, I cannot physically tell you whether or not that's cancer. We have to numb you up, take a piece, send it to a lab, and let them look at it under a microscope.
So we are talking about what's going on here in the weather. It's warm. People are going to the water parks, the beaches, the pools. So what should we be doing other than covering our feet? How should we protect them both prior to going in the pool or the water and then after we get out?
Well, main thing after you get out is dry them. Dry them really well, especially if you've been in the pool all day.
Because they'll be wrinkly.
Well, it can get really wet in between your toes, and moisture can build up, and you can start getting some fungus and bacteria and yeast living in there. Especially your kids, you want to start checking their feet more because this is peak season now for warts, athlete's foot, communicable diseases. Well, sometimes you can see MRSA depending on how clean they are. And that's a bacterial infection. That's very common in confined spaces. So you're running around, especially your kids, running around. But if you a couple of days after you take them to the park, they're like, my feet itch. They may have picked up some athlete's foot or something, or this little spot hurts, then they might have picked up some warts or things like that. That's real common from walking barefoot.
Okay. And you mentioned odors. So, Dr. Richmond, you have a foot spa on site.
Yes.
Where people can come and really have a good bathing for their feet. Tell us about that.
So we have a foot spa on site. It's done by the medical assistant. So you're put in a private room in a massage chair with music and lights. And so you get a 15-minute soak. Then they come in and scrub your feet with pumice stone and pumice stone scrub. Give you a light massage and misting. That's $20. If you're an existing patient, you can get 1/2 off on your birthday. And we're also on Groupon as well. So a lot of patients will come and do that before they're seen by me or the other doctors and get pampered. And it also helps softens the nails, calluses, and things like that. Or we have people who just come just to the spa. We have a lot of Grouponians that come in from Groupon and come all the time.
Of the sales.
And
more people.
Then we also have a 3 for $30 in office. You can buy a 3 for $30 card. It doesn't expire, but you do need to keep up with your card. And it is by appointment only, so you have to call in. You can call in at 937-228-3668 on Tuesday because we're closed Monday. And you can schedule it. And like I said, a lot of patients will schedule it right before they're seen by me.
So, Doc, you also have a foot boutique where you have an array of items that people can purchase. And if you're a patient or not a patient, you can walk right into your office boutique and purchase some of those items. Tell us, as you go around the room, give us a visual of what we can expect to purchase at your foot boutique.
Well, we have antifungal toenail polish, toenail liquid. We have foot creams, lotions. We have diabetic socks. I just recently got some new socks in. We got compression socks. We got little short socks. Then we got, now the company I get them from has dress socks. I got some dress socks. We have all kind of pads, hammer toe pads, bunion pad, corn pads, callus pads, toe spacers, heel cushions. Cushions go in the back of your shoe if you're rubbing. And then as far as we have custom orthotics, we have over-the-counter orthotics that you can purchase. Well, custom orthotics, you would have to be seen and sent out. Over-the-counter, you can come in and purchase. You just need to schedule an appointment for those. And then we also have little steps, which are for kids. So they're from 1, I think, to 10, or whenever they grow into adult shoes. Mm-hmm. And those are for any child that's having any kind of problems with walking. They may be falling, they may be stumbling, or they may be a delayed walker, so they're walking later in life, or you're or also complaining of pain. Children are not smart enough or devious enough yet to lie. So if they're telling you they're having pain, they're having pain. They generally don't make up stuff yet. So don't say, oh, it's just growing pains, or like flat feet. Children would develop an arch by 4. So if they don't have an arch by 4, they're not going to get one. So there are orthotics that can help support their arch and support their feet. There are actually surgeries up to the age of 18 where we can put something into the ankle joint and create an internal arch. But that's up to the age of 18. And that can be created after that, but it's a lot more complicated surgery.
Oh, wow. That's really something. But if it's something that needs to be done, it's something that needs to be done. They can get that taken care of.
Yeah, or you can do more like as you get older, custom braces and different things like that are on the outside versus internal surgery. It all depends on how healthy you are.
You know, Doc, I know sometimes we get questions when you're not here. I know we've gone over this before, but I feel it's necessary for us to share again. That you actually treat young people too.
0 to 100.
0 to 100, and we've mentioned that. And so share with us, if you will, for those parents that have inquired about having their children brought to your office to have their feet checked out. What are some of the things that you're finding with their younger feet?
Well, mostly with little kids, toddlers. Most of the time it's more pigeon-toed, they're knock-kneed, they're bow-legged. I do see some syndactyly every now and then, which means when they're born, some of their toes are fused together, and that's a surgical procedure. They have to be unfused. But then the problem with that is finding someone that does that and who's comfortable with doing that, because there's a lot of microsurgery involved. When sometimes you see surgeons with the microscopes on their lenses because that anatomy is so tiny. Actually, I saw a little girl. She had on both feet. She had a couple toes that were fused, and I suggested she go either to Children's or probably Cleveland Clinic's Children's Department, Orthopedic Children's. Because for something that unique, you need to be with someone that sees it and is comfortable with doing that. Because if it's done incorrectly, one of the toes could die because you could damage the blood flow trying to separate the toes. And
in that case, there would be what, amputation?
Yeah. So and then sometimes it is a cosmetic thing. Because I actually had a lady who brought her little boy in as an infant with syndactyly. And then she came back about 2-3 years later, and she wanted me to work him up for disability. And I told him to go run down the hallway. He ran at full speed. I was like, he's not disabled. Because it wasn't changed.
Successfully.
Oh, yeah, no tripping, no stumbling. He took off. So she didn't understand what she probably just wanted a check, but she didn't understand since he was born with this, he adjusted. So to you, it's abnormal, but to him, he's never known not having his toes fused. But especially children who are pigeon-toed, where they have in-toe gait, there are things called gait plates that can go in their shoes. They're like inserts that can help turn them out. So as they grow, their legs will grow straight. Yeah. Now, bow-legged, that is a surgical procedure. That's lack of calcium. When you see kids that have severe bow legs, they didn't get enough calcium as children. But if they can, that would be more, that depends on how high up the deformity is, if it's in the legs or if it's in the femur. So that would depend also, maybe an orthopedic problem. But they will not grow out of bow legs, because I recently saw a guy. He was old with bow legs. They don't straighten up. They have to be straightened.
So is that something that typically takes place in the wound, or when they?
No, bow legs usually as they grow. They're like toddlers, and they're not getting enough calcium. So the bones start to bow. They start to bend because there's not enough calcium in the bone. So they're not getting enough calcium as they grow, and the bones just grow abnormally. You don't see it like we used to probably before we got into the, checking children for their bone density, calcium, and all the different things. And then, with the lead exposure, I work at Drew, so I'm right next door to WIC where they check the kids for lead exposure, things like that. So they're checking kids for now, but back in the day, before those programs even existed, if you were just bow-legged, you were bow-legged. And if your mom didn't have money, it'd take you to the doctor.
So it was not a whole lot that they did about it back then.
No, it was just, you'd be all right. But now, with us in the advances that we have and the income that we have, if we see something wrong with our child, we're going to take them to the doctor and have it checked.
Yes. Okay, Doc, very interesting. We're going to take a short break, and when we come back, we'll let you tell us about the special free evaluation that you have that takes place on Thursdays at Richmond Foot and Ankle Clinic.
Okay.
We'll be back in just a moment.
Hello, this is Dr.